First time here in Fargo Village in Coventry for our first podcast, just down the road from the head office, joined by Richard, the CEO of the business. I'm Lewis, for those of you who don't know me. I'm the Chief Operations Officer. And we're here today, to shoot our first pod, so quite exciting.
Yeah, we did attempt, I think it was our 10th anniversary. We did.
Yes.
It wasn't as professional as this sort of setup. It was very rudimentary, but it did attract quite a lot of conversation, didn't it? You know, a lot of people in the region, particularly.
The interaction was impressive, and that's why we've tried to go up a notch today.
Yeah, it's great. This is not what I remember of Fargo Village, but it's fantastic, actually. My first time to properly explore it, and it's amazing, actually, what's going on in our own backyard sometimes, and we don't even realize.
Yeah. No, really, really lovely venue. We'll get started. So, really, I just wanted to start from the beginning. How did the business come about? How did the Manchester Training Group come about?
Yeah.
And why do we need to exist in the modern day?
Yeah. So our background, as you know, in recruitment, healthcare recruitment. So we used to work with the NHS. We started late 2011, but properly started running in 2012. So a lot of the work we did was in the NHS, headhunting, actually, clinical teams, venous thromboembolisms, people that were working in theatres, in ophthalmology. We ended up working with even Her Majesty's prisons at the time, and correctional services, private hospitals, charities. So it was a time when the recruitment sector was changing a lot. You grow very fast as a company, but there are a lot of challenges, cash flow issues, invoices not being paid on time, competition from big players. They're taking your staff away because they can offer a bit more than you're doing as a startup. It's quite challenging. But we braved it up to 2014. Good turnover, good growth, but it's getting more challenging because people were now concentrating businesses. They'll buy up businesses and create these, huge recruitment companies that were taking everything away.
Yeah.
And because we needed to train our people for the regulatory compliance requirements, but also people that were going on to those specialist roles. We were having to do a lot of in-house training, practical training within Coventry University, set up of the technology park. And so we were actually building an internal learning and development department without even planning to, right? So when we decided in the end to exit the recruitment sector, we actually had almost like a business ready to go as far as governance and compliance in health and social care, learning and development, specialist training. We had also done quite a lot of training with Recruitment and Employment Confederation. Kevin was the CEO at the time. He helped us a lot. Denise Walker as well. I had to go actually and do 5 days training in London. Denise and they had some lawyers and several other people training us on employment law. They were training us on governance and compliance, the requirements of the regulatory bodies, and we could then build on the back of that actually a compliance business. So that's how we started. By 2015, actually, we had completely exited the recruitment sector, and we were now in this new sector where, there were a lot of things changing at the time, but we were changing as we went as well, because at the time, organizations like Skills for Health had started in 2013. And we were one of those few private sector companies actually that knew what they were doing in that area. But we focused primarily on healthcare, your Harley Street type of organization, specialist teams that are in the major cities and spread across the country. And we realized straight away that we had a unique sort of position, having come from the NHS ourselves, from clinical positions in research and development, but also working as recruiters and then getting people ready for work. It put us in a very good position. And that's built on our core values as well as a business. And we knew that it was always going to be about technology, right? So I know, obviously, you joined us around the time in 2012. What was your experience, like getting into this sector from engineering, for example? I know you're coming from engineering. Yeah.
Well, yeah, I think it was the amount of detail really that goes into the regulation side and the amount of boxes that have to be ticked.
Yeah.
The amount of things that even as an individual health and social care professional, you have to do. But even from a business side, it's not just a case of getting staff, sending them to work, and everything's hunky-dory. There's a lot of other challenges in place. And that's what I think gave me the passion to stay with the business and help the sector and industry. And hopefully we have made a difference to a lot of individuals and businesses in the UK,
Yeah. Okay, so if I take it back to statutory and mandatory training, because that's what we're known for.
Well, yeah.
we named the company the Mandatory Training Group, and it comes with benefits and disadvantages as well, as you know. So statutory training, that's what the law says. Like health and safety training, fire safety, you have to do those things.
You've got to do them,
because the law says so.
Yeah.
It's very clear what you need to do. Then when it comes to mandatory training, it confuses people quite a bit. So I think it's important that I clarify the definition. So mandatory training is then what the organization does to say, look, we are going to offer these services. What are the risks that are inherent in offering those services to us as an organization, our staff, our service users, visitors, there are requirements to do these things. So it's up to the organization. There isn't a list that is pre-prepared. Each organization will vary differently, and also the levels of those training courses will differ. So we are 12 years in the business and we still have to define these things. How do you find it actually when you're talking to people? About normally they come to you for training, isn't it? They're not thinking about the wider compliance.
Well, I suppose that's one of the misconceptions with the brand name, like you've alluded to. A lot of people look at us as a training company straight away, which is something we've tried to diversify away from. But I think the common challenge when it comes to mandatory and statutory training is that it's almost like a standalone item.
Yeah.
People aren't mapping it to the fact that it's going to have an effect on policy. It's going to have an effect on standard operating procedures. It's going to have an effect on the overall organisation. People think it's something we've got to do. It's a pain in the backside. And as we know with most companies in the world, compliance training, it's the bottom of the budget. But sometimes it could be the most critical factor in actually going from that poor rating or requires improvement rating with the CQC all the way up to something like outstanding.
Look, it's something that, because I do a lot with business owners. A lot of them are colleagues, former colleagues that I worked with that are now running businesses, they're senior executives. And they're so far removed from decision-making when it comes to general compliance day-to-day. I've got a compliance officer or I've got a registered manager. They deal with that. But actually, when you look at the CQC well-led, I was at a conference last week for healthcare leaders in Birmingham, and we were in the fortunate position of having the Chief Inspector for Healthcare from CQC presenting. And I liked what he talked about. He was talking about the importance of actually leaders of these businesses understanding what well-led means in practice. It's not ticking boxes.
It's not just
well-led means that we hire the right people, we have safe recruitment protocols. Well-led means that we have diverse teams that bring different skills. Well-led. So you went through really listing several things, and you sort of think, that should be common knowledge. We shouldn't be lectured at this point.
No, you would expect. But like I say, a lot of company owners go into these businesses not really knowing the sector in full. I think that's the other challenge. Not every health and social care business is run by an occupational person. It could just be someone who's funding something. It could be someone who's seen an opportunity in the sector, which obviously there's nothing wrong with that. But, if you want your service to comply, if you want to make sure it offers the best quality of care to its service users, then these things are important. And I think, that's obviously the challenge with what we do, trying almost not to sell it just as training or just as compliance. We're trying to actually help the business, almost consult the business so that it can go to the next level.
Yeah, because it's about the culture, isn't it? You rightly say the sector, actually, because there's a bit of snaring almost. It's like, for me, you move from a clinical position and you go into private sector to run a business. People sort of pinch their noses, they see you. And people have said that in my face. They say, I can't believe, almost like you moved to the other side. And think, well, look, the industry needs people like me coming from the clinical side into this space, technology, how technology is built. That's what I did for my PhD research anyway, to look at adoption and diffusion of innovations. But also we need people that are coming from banking, people that are coming from engineering. Like you were coming from Jaguar Land Rover, from an engineering route, and you changed to come into the service industry. But a lot of the skills that you learned at Jaguar Land Rover were very useful to us as a business. And even up to now, so it's really crucial that we have diverse groups of people coming in.
Definitely.
And I remember in the late 90s, early 2000s, they used to say that the care sector was as safe as bricks. If you invest in the care sector.
Yeah.
But gone are the days where you just invest and then you stay away from the business.
Exactly.
Now,
it needs
actually,
more hands-on.
Exactly.
Definitely.
If you are investing in this sector, you need to be more hands-on. You need to really learn actually what needs to be done.
Knowledgeable, yeah.
Exactly. Understand the legislation, the regulations, and also know what your people are supposed to be doing and preparing those people. Which sort of brings us nicely to the next sort of strand of questions that I had from our team. So compliance or lack of compliance, what is the impact on professional development, workplace safety, patient safety, and also thinking about the CQC, the new single assessment framework. How have you found it actually, this transition to say, look, during COVID, things changed a lot. Even CQC could not go and inspect organizations the way they used to before. Then obviously after COVID, CQC themselves are facing a lot of challenges.
Yeah.
So organizations that are relying on the regulatory body and the regulatory body themselves actually are being questioned as to whether they're fit for purpose. So when you're dealing with our clients day to day, what's the landscape like?
Yeah, I mean, like I say, with the new single assessment framework, it's obviously panicked, I'd probably say, a lot of the providers or the clients that I deal with.
Yeah.
They're maybe a little bit unsure on how they're going to almost evidence their compliance, and that's where obviously the ComplyPlus platform that we've developed comes in.
Yeah.
But yeah, I think mainly it's trying to get these business owners or decision makers in these big businesses to understand the impact of training, the fact it gets better results for service users, the fact it makes the organisation or the workplace setting safer. Like I say, then things like inspections and when they come in, or audits when they come in, things are there. And if you can have evidence-based care, which I think is one of the things CQC are pushing at the moment, that goes a long way. But again, it's trying to take that hat or those blinkers off that are looking at training, or, we're just doing this, it's training, we're ticking a box. And that is always a common, difficult conversation, and also making it cost-effective for these businesses, because we know since COVID in particular, the cost of just running homes or practices or hospitals even, we know the cost has gone up astronomically. So the key really is to get a balance so that we as a business can function and make money like businesses need to, but ultimately offer a good product that's going to help these businesses, not just tick a box, but actually help them, develop them, grow them. And that's the message really we're trying to get across all the time with what we're doing. But yeah, I'd say that is the landscape at the moment.
Yeah. So, but the good thing obviously is that CQC have kept the 5 key questions.
Yes, that's remained consistent.
Yeah, so it's a better starting point. Of course, we don't call them key lines of inquiry anymore.
No.
And then obviously the way of evidencing has changed. And that, for us as an organization also is helping organizations to digitize what they are doing, because it's a very traditional sector. Even when I worked in the NHS, we were introducing technology and people hated, decision support systems. They prefer to do things manually. I can work it out myself. I can write it out better. But I sort of think, well, but it's not a portable document. It's a bit of paper that's going to be put away somewhere. And if you put it onto this digital platform, then I can access it from that clinic, or if I'm discharging a patient, I can get. So it's a cultural shift. That's what I've seen as well. Sort of say, look, the impact on professional development, because obviously for professional perspective, if you don't keep up with these changes, then it can impact your ability to practice or to practice safely.
Of course it can, yeah.
Right, like nurses also now, remember, they now need to evidence their CPD every 3 years when they do the revalidation with NMC for nurses and midwives. And same as doctors, you were talking to the General Dental Council on how we certify people so that it meets their requirements as well.
Yeah.
So all these professional bodies and regulators are now demanding more digitization. And in a way, because when we started, I remember we niche businesses would get it. You know, if you think about the typical diffusion of innovations, you know, you get that initial 10% that just
get it. Yeah.
But now people are being frog marched into using tech. So I don't know, from your perspective, how is that working? Is the culture shifting? Do you see a change there?
I think the culture is shifting, and even the way people procure these services is shifting now. You know, you've got things like off-the-shelf purchasing, you've got subscription purchasing, but I think this idea of having things in one place in a digitized system, it's slowly being adopted. There's still resistance, but I do feel people are coming more on board with it because it is the way the world's going, and all these new initiatives at the moment, even with AI and other sort of big tech that's coming in. Every business has to evolve in every sector and every industry, and health and social care is no different. So, at times it can be challenging. We have a big team that obviously spend a lot of time doing tutorials, how to use the system, you know, forgot password, login details, basic things like that. There's still challenges there. But, I think slowly people are coming to the tech side, let's say,
So, adding on to that, obviously, when you look at the governance and compliance requirements for health and social care, I keep going back to the well-led domain, so to say. It's about leadership, actually, because obviously, if you're not well-led, you're going to struggle to, you know, make the organization safe. You're going to struggle to be responsive. You know, the caring side, you know, effectiveness is all these things are crucial. We have had to add additional services. You know, for example, you know, moving away from just training to look at the overall compliance with ComplyPlus, which is a product that we've been developing over the past few years, and it's now being used. So when people are using compliance tools like ComplyPlus, how are they finding it? You know, that integrated system whereby it's not just the e-learning, but it's now covering several other things. Because my experience before was that, you know this as well anyway, because we used to go to some of our clients and you look at them, they're using 6-7 different platforms where they're logging into this one to get a bit of information, they're logging into another one to get a bit of information. And our thinking, obviously, with ComplyPlus was to change that. How has it been so far?
Well, that's where the initial market research was done to sort of say why are service providers having 6 or 7 suppliers for compliance and training, basically. So, I think, you know, that holistic approach that we've gone for with ComplyPlus is being well received, you know, and also incorporating things like the blended learning. Now we've opened up the centres, the classroom training centres in London and the Midlands, and we've got the one in Manchester opening soon. So, I think the key there with ComplyPlus is to try and have everything in one place, and that's what we're striving towards. But you can't then ignore things like the practical assessment. You can't do all those things virtually. I know it was accepted in a period of time where there was extraordinary circumstances, but we don't want to ignore the fact of good quality training because that's what we're trying to promote. So, you know, the idea of having policy and procedure documents and templates in one place, being able to evidence and audit that through a system, having your e-learning there at hand, having things like reports, certificates, all those sort of things are really important. And the other thing that obviously has been a real sort of game changer, I think, with a lot of our clients is the train the trainer and the trainer management system. So actually upskilling people within the organisation who can deliver some of this training on site and have that higher level understanding actually of some of these topics, rather than having to come to external businesses or external consultants all the time. So I think, our approach, I think, is being well received. And we're always looking for advancements. Even at the moment, I came out of a meeting yesterday, some really interesting ideas about how we can take ComplyPlus forward. And a lot of that is customer-driven feedback.
Oh, yeah, definitely.
So that is one thing that we really do respect and we really do like to hear,
Obviously, picking up on that, the onus is on evidence-based care, right? Where, you know, sometimes we're dealing with guidelines that are superseded by events. And with Train the Trainer, because I come from this industry traditionally where as you go up in the different stages, there's a lot of on-the-job training that is not formalized, it's not documented properly. And even some of the induction programs, even some of the largest organizations, actually, the induction programs are not documented properly. And my input with this was to try to reduce that gap from evidence to practice, to say, look, when you do train the trainer, we know that there's a lot of on-the-job training in the health and social care sector, whether it's medicine, nursing, or care work in the community, primary care. There's a lot of on-the-job training, a lot of supervision as well, but quite often it's not documented. And then obviously when CQC and other regulators and commissioners are coming in, they want evidence that things were actually done. The old adage is that if it's not documented, then
never
it hasn't
happened.
happened.
Yeah, well, I actually went to a conference at Edgbaston last year where they were explaining the new CQC assessment framework. And like you say, evidence-based, capturing the wow moments.
Yes.
These were the things that were highlighted to the other people in the room. And then that's obviously gave us some inspiration for our product. But also when we speak to clients, we're saying, what's happening, whether it's in the home, in the practice, what are the things you can capture? And then that's when the digital platform has a lot of weight because, where are you putting this evidence? Where can it be easily accessed?
Yes.
And that's where our sort of platform comes in. But yeah, evidence is the key. And it's almost that proof of self-regulation.
Yeah.
How are you, CQC are ultimately saying, how are you going to prove that you are compliant? And like you say, if you said it happened but you've got no evidence of it, then it might as well not have happened.
Yeah. Because obviously CQC's role, the Care Quality Commission's role is to they register organizations, the regulatory platform, and monitoring, inspections, and ratings. So, but actually, the push now is for organizations to almost self-regulate in a way. So
there's
it's
definitely
smart
a hint
regulation, and like we were saying earlier, people are now being pushed to use tech a lot more. Obviously, the climate in the sector right now is quite unique. And I think we say this all the time. I joined the NHS in 2001, late 2001. And every year people were saying, well, we've never experienced these sort of challenges. And every year it almost gets harder and harder. Not only the NHS, even the adult social care sector, people that are in third sector. We know some organizations are really struggling. A lot of challenges, staff turnover, recruitment is difficult, so we're having to rely on international recruitment. The increased scrutiny on CQC as an organization as well.
Yeah, doesn't help.
It doesn't help, right? Then the funding pressures. So we are working in an environment that is quite difficult. And you do feel for some of our colleagues, who are actually running services. Our job is to support them, but obviously you see some of the challenges that they are facing. How is that experience been for you and your team? Because obviously on the front end, I don't tend to deal with clients like that. I'm more sort of like on the development side of things.
Yeah. I think it's an interesting point. Like you say, there are a lot of pressures. Funding is always a problem, high turnover. We know there's been a staffing crisis in the UK for health and social care sector over the last few years, particularly since the changes in the EU and so on. So I think, obviously there is a lot of stigma in health and social care around technology and the use of it and how do you adopt it, and almost sometimes a defeatist attitude, I feel, with some of our clients where they don't want to almost learn this new way. They're quite happy with their previous methods of pen, paper, filing cabinets and whatever else. So I think, we are slowly scratching the surface. We're trying to make things as easy as possible, whether that be with your sort of interface design, your dashboards, trying to make things intuitive and so on. But there is always a bit of resistance with technology, but I think it's always the way you frame it and how are you onboarding the client? How are you inducting this new platform into a business or this new technology into a business? And as long as people then start feeling comfortable with it, it can be accepted, it can be used, and then hopefully it can thrive. So, I'd say there are a lot of the challenges. And like you said there about having 6 or 7 systems, if a member of staff in, say, for example, a care home or any of the adult social care settings really have all those different systems, logins, passwords they have to remember. Is that really the best use of their time with all the other pressures that they have day to day just doing their job? And that's our mindset, really.
And obviously, if systems are not talking to each other, I found that as well in my
Data
experience,
transfers,
doing research in technology and healthcare. One of the issues was lack of, connection. you guys call it something from a technical perspective.
I think it's
integration, isn't it?
Yeah, the lack of integration and meaningful output as well, isn't it? Because at the end of the day, you want these systems to tell you meaningful things, whether it's decision-making things, whether it's things that can give you stuff quicker than if you had to go and investigate it. But if the tech can do it, you know, the tech is reliable a lot of the time. So, I think it's a good point about integration. You know, you still get a lot of spreadsheets being used. You still get a lot of memory sticks being used and sending files on emails.
Then from a GDPR perspective,
then you're opening other cans of worms with that as well.
Look, one of the things, and you know, is that it's not a sector that is very good at adopting or accepting technology.
No.
And sometimes actually people almost, I don't want to say it the wrong way here, but they almost show you that they don't want to use this. I had that experience because you think, oh, we are adopting this tech, it's going to change the way things are done. So when you get a patient to come in, do the risk assessment, then you work with the tech guys to truncate the regulations, the key points of the regulations or guidance, professional guidance into steps as you are recruiting. But then people turn around and say, but we're already doing it anyway. You know, I don't need a little bit of technology to tell me how to do my job. So there's that where people just refuse to use it, right? But also there's the element where people sometimes don't know how to use things. You know, like computer illiteracy is a big issue.
It is. And I think also what you're pointing out there about the resistance is sometimes because people fear the tech, that it's going to overtake their role. Or, you know, will I be needed in 2 or 3 years if this tech actually works? So, I think that's a really, really good point. And the illiteracy side is important, hence why even from our side, and I know it's becoming more popular amongst some of our clients, they're trying to seek either funding for IT training or computer skills training or Microsoft 365 training because these are basic skills in the modern age. But obviously people working in health and social care who are maybe in their 40s, 50s, 60s, you know, this would still be quite foreign to them perhaps,
So one of the things, obviously, and I know we alluded to this earlier, post-pandemic, you know, how this sector has changed. Obviously, you know, we had several governments, you know, if you think from Theresa May to Boris Johnson, Liz Truss, Rishi Sunak, and now we've got a new Labour administration. Huge changes, several health secretaries with different ideas on how things should be done. And even now, we are not clear yet which direction things are going to go with the new government. What does it mean, the day-to-day? Do you see that playing out as well into how people are behaving, decision makers are behaving, health and social care leaders also are making decisions?
Yeah, I don't think it helps. I think when a lot of clients at the moment approach me and my team, there's a lot of confusion on what actually they need. They have a rough idea, you know, they know the mandatory topics, you know, they're not completely sort of unknowledgeable in that area, but there is always a bit of sort of misunderstanding or misconception. Do we need that? Do we need that? Should we have this? And like you say, that chaos from, like you were saying about, led, you know, ultimately the government are leading in these areas. And if that is chaotic and there's lots of changes, there's no stability, then it does filter down. So I think we are seeing it. And then, like you say, there's no expectations. There's pressure on CQC at the moment. That organisation's changed. Even some of their board members and directors are changing at the moment. So, you do sense it when people come to you. There is an air of, let's say, desperation when some of these people come to you. And you almost do feel sorry for them, but it's our job to try and help them.
Yeah, definitely. So, to top that up as well, you know, we talked about Skills for Health earlier when they created the core skills training framework. The focus is now on England rather than the whole of the UK. So the idea obviously was defining the essential statutory and mandatory training that is required for healthcare workers. And I know it's used also in the other social care sector as a guide because Skills for Care had not defined fully what was needed. Do people actually understand what these frameworks mean? Do they know how to use them? You know, because obviously, like what you have said, there's sometimes people are coming to you and they don't know what they're supposed to be doing.
No, I think it's a very good point. I mean, this sort of CSTF label that's almost going across all these subjects now, like CSTF BLS, CSTF infection control. People are just saying it, and you sort of think, do you really know what it means, what it stands for, even?
Yeah.
And yeah, you know, we've tried to build a relationship with Skills for Health. They've started to go in a slightly different direction. They're actually offering some of this training now themselves. So yeah, it is almost a question of what are they standing for?
Yeah.
You know, are they a regulator? Are they a framework that we need to abide to? Are they making the laws? Are they a commercial company? Are they consultants?
Yeah.
I think there is that sort of mystery about what they're doing at the moment. And even with our clients, you sort of listen to them on calls or, you know, email exchanges or whatever it is.
Yeah.
You almost have to define what the core skills training framework is and why it's important and why it was brought in. And I think people have forgot that purpose, mainly because even that organisation,
They're not clear themselves.
they're not really clear themselves, I'd be honest to say,
I found it, you know, because I sit on the other side where you are looking at the guidelines, legislation, developing content. The framework that we're using right now, the CSTF framework, is from June 2021. And it's been superseded a lot. We're now in 2024.
It's over 3 years, isn't
if
it?
I want to do, if I'm looking at resuscitation, I'll go to the Resuscitation Council. Because otherwise I'm not going to cover everything if I use the core skills training framework. But also, you know, like saying, when I look at the Resuscitation Council, yes, they've always been involved in training educators and guiding on how training should be delivered. And you appreciate that. It's very clear what they do, but NHS England, Skills for Health, Skills Network, all these organizations now, for me, it's almost like they want to develop the guidelines and guidance, then they want to deliver the training themselves. So for us as private companies, even we struggled to get any meaningful relationship with NHS England. In the end, we just gave up because it's completely pointless. Right, and it was quite frustrating because we went there with good intentions. We had a good relationship with Skills for Health and Skills for Network, Skills for Care. But then you get to NHS England and you just hit a blank wall and you almost feel like you're talking to the wrong people. You don't know in that organization who you should be talking to, because I'm thinking at workforce development level, right? If I were to take a job there, I would be looking at a very senior job, whether it's policy development or whatever the case, right? But then you're talking to people sometimes that are so junior in these organizations, they don't know the implications of these, you know, destroying relationships sometimes, actually, whereby you give up. You know, even local authorities at times point sort of think, what's the point? You know, let's just stay in our space. Then they come to you as well sometimes and they want your content, because although they are well funded, we have to work hard to earn money, right? And respect in the sector, you know, and stay ahead in every single way. And the sort of thing, you're well funded. I pay taxes. Our company is paying taxes as well. You guys are well funded, but they are not working. They're not doing enough to build relationships with private providers. It's almost like it's sneered upon to have the NHS taking services from the private sector. So then there has to be a club of organizations that are like-minded. And
in that network, basically.
Then they create their own little network whereby everybody else is excluded. That's how I feel from where I sit. So I don't know from your perspective, to sort of say, you know, do people realize actually what these things mean? Do they realize? Some people think actually that the CQC accredits things. No, they don't.
Or endorse
They're
things,
regulator.
they don't.
What is the role of NHS England? Well, they're doing a lot of things now because they've combined a lot of organizations, and I get it, there's need for reform, but what is the role of Skills for Health? I've absolutely no idea now what they do, because I look at the framework, it's so outdated, I don't bother with it, actually. I just keep an eye on it to see if there's any new changes. But otherwise, if I didn't know what I knew, and the other content developers that we work with didn't know what they know, would be using very outdated information.
Yeah.
You know? And then, you know, we've tried to raise these concerns at times, but you sort of feel like you're talking to competitors sometimes rather than people that are supposed to be helping you deliver better services.
Better services, yeah. No, I'd completely agree with that. There's a lot of confusion, even misconceptions, like you say, about endorsements, accreditations, on whether it's a training course or you as an organisation sometimes. Because we've got our own affiliations, accreditations and so on, but we've tried to we try and do things legitimately. We don't try and lead people down a garden path or anything like that. But no, I think everything you've said, it makes perfect sense. And there is that need for really understanding what these organisations stand for and what they're there to achieve, like you say, particularly if it's public funded.
Yeah. So the other element is we've talked a lot about organizations because a lot of our work is B2B, business to business,
Yes.
right? And it's intentional like that. But we also get quite a lot of B2C.
Yeah.
People just coming in,
sector,
whether they were independent practitioners or they're working with recruitment agencies, they come. Do you see any difference at all as far as in the understanding or culture as far as compliance is concerned?
Yeah, I definitely think with the sort of B2C contingent that we attract or that are with us at the moment, that there is this adoption for the blended side of things. That's why even the open centres have been a bit of a success recently, where people are dropping in for their key practicals like the basic life support or the moving and handling or the fire, and then they're doing the rest online. There is that sort of shift. And I think also the idea of having this tool where you can put all your CPD, log all your CPD, because it can help with things like the NMC revalidation, the GMC revalidation, and the other things these professionals need to keep up to date with. And I think actually having a place where you've got meaningful articles about what's happening in the industry, because a lot of these professionals, they don't necessarily have the time to watch the news, actually know what's the things happening in Westminster and how it's going to affect their day-to-day life or their roles. So I think people are definitely becoming more on board with the idea of doing things online, doing some things in a practical environment and using that blended learning sort of cliche term. Whether they still really understand why they need CSTF training, particularly for, like say, the healthcare side of things, I'm still unsure.
It's a label.
Based on, it's basically just something you're putting in front of everything else. Mandatory training, now it's CSTF mandatory training. So I think, there is an element of that still. And I know even our company have tried to define what this is and why it's important. Why does it matter? Why is it important? There is a framework there that we need to adhere to, or even from a legal perspective, why do we need to adhere to it? But like you rightly say, it's about keeping up with things, and a lot of things changed after the pandemic. And I think that also does concern people to sort of say what they did for all the years prior to, say, something like COVID, and now have they been taking their training or their mandatory refreshers? Have they been taking them seriously enough to actually understand some of these changes to offer the right care? And even with rises in sort of legal cases in health and social care, the panorama programs and so on, it obviously with some of the professionals I've seen and dealt with, there is that concern to sort of say, if I actually make a mistake at work, I could actually end up going to prison or something like that,
or losing my registration,
or losing your PIN.
I go to our training centre in London weekly just to keep up with what's going on. And a lot of people do use these phrases, these labels. And you have to explain what they mean, because sometimes they just, is the certificate going to say this? Is it going to say? So for them, really, is because I don't want to spend the day here and then have a certificate that doesn't mention
it's
this.
It's not going to work for me.
So it's almost like, okay. I don't know, in another world, people would just go and print certificates that say the right thing, isn't it? But obviously you have to deliver on that before. But anyway, look, one of the things to think about as well, sort of how the landscape has changed. To say, I remember one time, one of our clients that we were dealing with, I think they had 9 sites, and we're trying to get them to accept that blended learning actually would work. This is about 2018, I think it was. And one of the directors turned around and said, well, e-learning is not really training, is it? Because they preferred everything done face-to-face. But I'm sort of thinking each of their sites had at least 100 workers, and they've got 9 sites. And so trying to explain to him, so I said, look, you don't need to do, there's a lot of theory actually, even with practical subjects. There's a bit of theory. People who can do that online and then come and do the practical. I used to do, when I worked in the NHS, we used to do advanced life support. And when you were registered for the course, you would get the booklet. Then you read through the booklet, the guidelines and the different scenarios and things like that. And then you go in for a 2-day practical now, where you will be assessed on different stations. So traditionally, that's how things were done. They were blended. It's just that we used to do distance learning, and we're replacing distance learning with e-learning. How is the balance now? Because some people were even thinking, now that we're doing things online, like basic life support, why do we need to go and do it face to face? So you realize you need to balance classroom, on-the-job training, and online training, some sort of blended learning approach. Are organizations more accepting of that now as a solution?
I think they're getting there. Yeah, there was a period of time when things started to be more relaxed after COVID, where people were thinking, well, we'll just do everything online and remotely now.
Yeah.
So, if we're not, why do we need to go back to previous times? But I have seen a shift now of people saying, look, we do need to get back doing practical assessment. We do need instructors. We do need to upskill members in the organisation, like I said earlier about the train the trainer.
Yeah.
So I think, digital solutions have surged in popularity, and we are seeing that with a lot of our clients. But the key, like you say, is to keep adopting that blended approach. And whether you're a big organisation or small organisation, it's really important to have that mindset.
Yeah.
There's not a one size fits all for this, in my opinion.
Yeah. I guess one of the things is that you could be purist about it and say, look, we need to do everything in classroom. But actually, classroom is not suited for everything.
No.
You need to think about how people learn. Different people learn in different ways. And if you provide these sort of digital solutions, then people can adapt, because even in different departments within one organization, they can adapt some of the learning differently. You can do drip feeding of content as well. You can do lunch and learn. But obviously with ComplyPlus, that's the ability to give you a training management system that you can then use to evidence all that activity, isn't it?
Yeah, that's the key.
Yeah. So, finally, we have to talk about the digitization of the regulatory compliance sort of framework. How has the response to ComplyPlus been? Maybe you could start by defining what ComplyPlus is actually, and how the rollout has been, and what the feedback actually from the various parts of the sector is.
Yeah, I think in the main it's been well received. I think as a business we struggled to really define everything that it is and how it can help businesses, and we did see that resistance. Whether it be in our marketing strategy, whether it be in networking events we attended, whether we were having informal or formal conversations with different businesses in and around the UK. But ultimately, having this holistic tool, people like the idea of it. Because like you alluded to earlier in the pod, you're going from having 6 or 7 suppliers maybe to having one. And that's a big shift even for things like the finance, the accountants, the budget, but also just the ease of adoption in the business. And implementation, of course. So, I think it is being well received. What we're trying to do is take on all the customer feedback at the moment, because it is still a relatively new product that we've launched. Things have worked, some things haven't. But like I say, a lot of people are liking the policy and procedure templates. It stops them having to pay some of these inflated subscription costs or having to develop them themselves, which is very timely and costly. The train the trainer and the trainer management side of things has been a real hit. That's worked really well in organisations. We actually went to see one of the clients the other week, and we're seeing some of these members of their team now growing into trainers, and there's on-the-job training going on, assessments, sign-offs, even with things like the care certificate. It's been really sort of refreshing to see. And even the sort of clever ways clients have been using the portal as well. It's actually even give us some inspiration and ideas.
And ideas as well,
So I think, overall, obviously the e-learning we're very strong on. We've got lots and lots of titles away from just your mandatory and statutory stuff. So people really like that. Like I said earlier about even things like computer skills. Even businesses are trying to think.
We can give them those.
We can give them those additional CPDs, which are really useful, not just for people's individual CPD sort of profile or portfolio, or for revalidation or whatever other things people need, but just general knowledge, and that knowledge then being within the business helps that business thrive
as well within the business.
Definitely. And I think that does make us unique, having all those different titles in our library, and we still see value to them. Obviously, we do serve other sectors as well, but even the health and social care sector have benefited greatly from that range and diversity of training courses that we offer. So, I think for me, adoption has been good. There's things that even we want to improve with ComplyPlus and places we want to take it. But the initial feedback has been pretty positive. And we've not had any issues really with any particular client.
Yeah. So, obviously, some of the key features, the e-learning is that there's a learning management system, then there's the training management system whereby people come in with their own certificates or they do their own internal training, they can upload. But obviously, with the trainer as well, we can provide them with the training materials that are properly developed and accredited, and a certification system. So document uploads, like a repository as well.
Yeah, the file library is really useful. And like you say, having that file upload option is the evidence side of things.
Exactly.
So allowing organisations to upload things that have happened, whether it's a photo, a video, a document, a signed docket of something, whether it's an internal policy. It's not just the policies and procedures we provide as templates that can be uploaded. And some businesses have now started to click onto that and really utilise that feature. But also the reporting side has been really good. The live reporting, the activity logs, what people are doing, even the GDPR feature we added about, where are people logging in from?
Yeah, exactly.
What agent, what sort of device, what browser. So even some of these, say, higher level things, which mainly, they do apply to everyone. GDPR applies to everyone. But for some of our sort of bigger clients, that has been a real winner. Those core features really will at least get you that good rating, which is obviously what we're always saying with CQC. If you can meet that basic threshold, and then people that adopt it further and use it better, let's say, can get outstanding. And we've got case studies for that as well.
Oh, definitely. Taking organizations from needing improvement to outstanding on their next CQC inspection. It's always great when you achieve that.
When you see that, definitely.
Yeah, but one of the things, because I was involved with the team that was developing the policies and procedures, my emphasis actually was not just providing templates, well-researched templates, but actually providing guidance for managers to sort of say, look, how do you implement? Because they still need to do their own risk assessment.
Of course,
they still need to do
their own. They can't just be used straight away.
Yes, they need to do their own needs analysis, so we provide them the guidance as well. So it takes quite a lot of experience and knowledge to be able to develop policies and procedures from scratch. So templates do work, yes, but you can't just take a template off the shelf and put your logo on, So we provide that additional guidance and training, but also keep the cost down, because if it's part of a subscription, then for all these services, then it keeps everything within one place. What I found, because I used to do research in this area as well, I used to do a lot of reading, I still do a lot of reading in this area, is that for these sort of things, it works better actually as far as adoption and diffusion of innovations, in the sense that if there's a regulatory change or legislative change, the best way to introduce it is through these sort of technologies, whether it's training that you are providing, whether it's changing procedures to say, look, this is how we're going to do things. You don't have to give people a whole lecture about the wider legislation, but you take the bits that apply, because there's so much legislation and regulations actually in health and social care, to the point where it can be confusing for people that just want to do their job and do the best they can. So I'm looking forward actually to how this pans out, the feedback that we get from the clients, and how we can keep adapting this platform and making it more useful. And also maybe when things settle down as we get into 2025 with CQC, it's promising now that actually the team there is really focused on making things better and building trust as well, because they've had quite a turbulent time. So rebuilding trust with providers. And I'm really looking forward to 2025. Actually, I don't know what your thoughts are as we go into 2025. Just 2.5 months left to the year.
Well, yeah, I'd echo your thoughts really. Hopefully, we get some stability, like we've been saying, in government with the regulator. Hopefully, some of the challenges health and social care providers that they will ease slightly as well. It'll give them more time to maybe think about things like compliance. What is their strategy to comply? How will they start recruiting staff? And all these things at the moment that are probably being pushed to the back of the queue because of the the day-to-day challenges they're facing. So, I think it's an exciting time, and hopefully with businesses like ours, providing the services that we do, we can really start making a difference and build something that actually is going to work. Not an ideal or fantasy product, but something that can work. And as you rightly say, be implemented properly.
Yeah.
And also for businesses to see the benefits of it.
Definitely.
Not just to be paying for it and then not being able to justify it. And that's really the key for me on what we're trying to achieve. Yeah.
Yeah, obviously part of it is, it still goes back to the regulatory framework. You know, you have to show that the work that you're doing is effective. So how do you know the outcomes actually that
By the
you provide,
outcomes, how do you
staff
prove that?
retention, and you know, so look, it's been I think it's been a great start to our podcast series.
Yeah.
I think there's a lot to talk about, and it always feels quite overwhelming, even when you know, the team were preparing some of the key points for us to talk about. But I always look forward to these sort of discussions, and I'm really excited actually to sort of see how our podcast pans out, and what the response will be like as well. Maybe we get more ideas as well from our internal teams as well as our clients as well, as to what to cover. Yeah,
definitely. Yeah, I think it's been a great start. So yeah, until next time.